Obesity is defined as having an excess amount of body fat. Being obese can increase the chance of catching multiple diseases simultaneously. This is known as comorbidity. An example is an obese patient who has type 2 diabetes and heart disease. Being obese is a risk factor that can lead to anxiety and depression, and more explicitly, heart disease and mortality.
In 1992, most states reported less than 50% of overweight prevalence. The next 3 to 5 years showed rapid increase in the 50% and more than 55% ranges. In 2004, all states except for 3 are beyond 55% prevalence. The trend of obesity shows increase over time. Worldwide, prevalence has doubled since 1980 that nearly a third of the world's population is now classified as overweight or obese. This is important to monitor because it is the leading risk factor for type 2 diabetes, which will lead to many different problems that may require long-term monitoring and good access to medical care. Obesity can also lead to hypertension, a risk factor for cardiovascular disease, pulmonary embolism, and more. Older adults are also more susceptible because of many aging factors. The number of adults with obesity has increased. In 2010, 28% of those 65 and older were obese.
To combat the epidemic of obesity, the Surgeon General has set forth 5 major goals which involve promoting public awareness of obesity as a major health problem, achieving healthier body weight in adults through good nutrition and exercise, implementing intervention strategies for both adults and children, creating positive environmental change, and partnerships with the community which will help achieve these goals.
Out of the 50 states, only 12 have passed some sort of reform. Here in California, licensed daycare facilities are required to serve low-fat or non-fat milk to children aged 2 or older and limit juices to 1 a day. School districts are also required to provide access to clean drinking water during lunch hours. Medicaid and Medicare now will cover nutritional counseling, therapy, and biometric surgery for individuals who are suffering from obesity. In order to stop obesity, we have to start educating children at a young age about health, and we have to start making healthier choices.
Because our portions have increased so much in the past 100 years, it's especially important for you to monitor both what you eat and how much you exercise, and to talk frequently with your physician about what you can do to be at a healthier body weight. This becomes more important with age as only about 11% of adults meet physical activity guidelines, and despite the fact that insulin sensitivity decreases with age, it can be increased through exercise to prevent obesity.
Young people, especially college students, believe they can eat anything they want, but this mindset will catch up with them when they age. You lose muscle cells as you age, which leads to quick weight gain. Obesity is not only composed of bad diet and lack of physical activity. Factors such as stress, lack of sleep, and medications are linked to weight gain. The health sector can make educational posters rectifying these misconceptions and post them in places where there are many people, such as town arenas, community centers, and schools.